Thank you for joining us in this episode of the lecture. I really want to use this lecture to talk about what is of great concern to me. Though I'm not really surprised, but it bothers me why generally people present to the hospital at late stages of their illness. For arthritis, people tend to present at later part of stage 2, stage 3, and even stage 4. And one begins to wonder, because there's nobody that will have pain and fold his or her hands without doing anything about it. But why people seek for medical attention late in their illness, especially arthritis, is because arthritis can be a very deceptive disease. So today I present to us arthritis, a deceptive disease. My name is Dr. May. You are welcome once again. It's interesting to know that arthritis is a progressive and destructive disease. It's progressive because it usually starts at a spot and as a mild disease, and as time goes on, it begins to spread, involving other tissues of the joint and becoming more severe disease. And as it's spreading, it is actually destroying the tissues of the joint like the ligament, the cartilage, and even the articular bone. Now, at the early stage, the commonest symptoms that it presents with is pain. One has pain because at that point, inflammation is the predominant component of the disease. And when you take some medications or treatments to reduce the pain, you might feel better. But the common experience is that with time, there is now loss of function. From pain, you now realize that you can no longer move that joint as you used to. You can no longer do what you used to do with that joint. If it's in the shoulder, I now realize that it's difficult for me to wear my clothes or wear off my clothes, or to scrub my back. If it's in the elbow, the same thing. To move my joint to pick up something becomes difficult. If it's in the knee, I found that I can't walk freely as I used to. Even I can't run, I can't jog. For those of us that like jogging, it begins to affect your normal routine daily activity. That is because from pain, the destruction becomes significant. And if nothing is done at this point, the person will realize that there is deformity of the joint. Using the knee, for instance, you see some people that have knock knee or bow leg. They were not born like that. It is actually arthritis that caused it for most of them. Now, how is arthritis a deceptive disease? It's very deceptive, and they are giving many of us many misconceptions. And that is what can contribute to living with arthritis for many years. Number one is that arthritis makes us to feel or to think that pain is all there is. As long as I'm taking care of the pain, we feel at the back of our mind that we are treating the arthritis. We forget that pain is a symptom and not the disease. Okay? Because it has made us to feel that pain is all that we need to tackle. Whenever we take treatments or any treatment at all, medications or all that, and the pain begins to go down, we feel that all is well, that the arthritis is being taken care of. But it is not true. And for some, the pain can be off and on, and we believe there's no problem because I can manage, I can go out, I can come back. There's no problem. But we might be watching it from off and on, it becomes a constant pain. And from being a constant pain, it continues to increase in intensity until it becomes a severe pain. Okay? And yes, if I can cope with the pain, all is well. I don't need to bother. It does not disturb me from what I do. No, yeah, I know I have pain, but it does not bother me. It does not stop me from going wherever I want to go. I go with the pain, I come back with the pain, no problem. The reason is because is all about pain, pain, pain. The arthritis makes us to focus on the pain, thinking that the pain is the disease. But no, the pain is the symptom. While we are focusing on the pain and pursuing the pain, the degeneration or the damage, the destruction which is causing the pain is progressing underneath until it gets worse. At that point, no painkiller can help. It's that destruction that leads to the loss of function. And what happens is the destruction usually starts with the soft tissues of the joint, or else those of us that had injury, fall, trauma of one kind or the other that leads to the breakage of their cartilage of the joint, like the meniscus. But ordinarily, it is the soft tissues of the joints that are first affected, like the ligaments, the bursa, the synovial membrane. So from there, it now affects the cartilage. The degeneration spreads to the cartilage, and from the cartilage, it now spreads to the bone. By the time at this point you now do X-ray, it begins to show you manifestation of the arthritis in the joint, like the bone spurs or reduction in joint space, because the cartilage has degenerated. If you continue to take painkiller, not minding this degeneration, most times deformity might set in. And by that time deformity has set in, the ligaments have become so deformed, so degenerated, they are practically not doing much of their function. For those that have this in their knee, common experience that some, as they're walking, they feel as if they have lost balance. They feel like they notice that they're about to fall. It's because the joint is no longer stable. The stability of the joint has been hampered because the ligament has weakened so badly. And the next thing you notice is severe degeneration or destruction of the cartilage. Okay, so the cartilage, for the ligaments, the cartilage will also be severely degenerated, and when that happens, in an X-ray, you now find out that the space that's supposed to exist between the two bones, or the bones forming the joints, will begin to reduce. It will begin to reduce to the point that it thins out, and sometimes it can even occlude completely. So the bones will now begin to deform because of the fact that the bones have begun to come so close to each other. The weight, when you stand or move, is now being transmitted from bone to bone. So you see the deformity of the bone, and it is that deformity of the bone that results significantly to the deformity of the joint. This can happen anywhere. It can happen in the lower back. It makes people to walk bent over. They hardly walk, erect. Some walk with hyperextension of their spine. These are due to severe degeneration of the ligaments and the cartilages of the joint. Now, it now means that for us to take care of arthritis, if you have to treat arthritis, it is the degeneration that you need to treat, because that is what is causing you the pain. If you leave the degeneration and you are treating the pain, this degeneration will be getting worse. And that pain you are taking medications for, no matter the bags of drugs you have, that pain will continue to get worse and get worse as degeneration gets worse. So this is how the bone is supposed to appear very smooth, but these are the degenerated bones. And degeneration started in the ligament. The ligaments are degenerated, and at a point it now spreads to the cartilage and to the bone. If you now leave this destruction and you are taking painkiller, the degeneration will continue to go on. So if you want to treat arthritis, target the degeneration. And if you now want to treat the degeneration, your best option of treatment is what? Regeneration. To regenerate means to heal, to repair, to restore back to normal. And there are treatments that can do that. These are components of regenerative therapy. Cold laser uses laser light, which when it enters into the tissue stimulates some biological processes that leads to the formation of new tissues, or what we call regeneration or tissue repair. This is platelet-rich plasma, PRP, which is gotten from your own blood. So it's your own platelet that is harvested and is injected into the affected joint. The platelets contain growth factors. So when they're injected, they release those growth factors, which begins to regrow the cartilages, ligaments, and other tissues of the joint. There's also what is called prolozone, in which a medical ozone is injected into the joint. This makes use of combination of medical ozone and medical oxygen. So when they're injected into the joint, they help in the formation of what is called ATP. ATP is the energy of the cell. So it gives the cell energy to rebuild itself, because the cell that is dying is lost in energy. So when you restore the energy, it tends to contribute to the healing of the cell and of the tissue. Usually in our center, we like to combine these three protocols, and that has given us very successful outcome in treatment of arthritis. So as we said, if you use this treatment at early stages of the arthritis, you stand up to 80% chance of complete healing or permanent cure. But if you are being deceived by the arthritis, making you to focus on treating the pain, by the time you are presenting, you might be presenting at late stage 3 or early stage 4, and this treatment might not help much at that point. Even if it helps, it might not get you to a permanent cure. It might relieve you to up to 50% to 60%. So this is what we have. This is where science has brought us. This is relatively new in our environment, but that's how to take care of arthritis. If you can regenerate the damaged tissues of the joint, you can practically wipe off the pain in your joint. Thank you very much for joining us. I believe you have benefited from this lecture. There are many people out there who are languishing in ignorance. It's ignorance that make people to depend on painkillers. Some have taken all kinds of concoctions and all kinds of treatment for the pain because they do not know that there is something they can do. If you can do these things early, there's no need for you to subject yourself to surgery. So ignorance is a major disease. You can share this lecture so that people out there can also benefit. Your friends, your relatives can benefit. And you can also direct them to join us in our various social platforms to regularly listen to our lectures, which will help them to begin to live pain-free. So if we join our hands and we are united, we can live pain-free. It's possible. With treatment, the chronic joint pain you are having can completely be wiped off. Thank you very much, and see you again in our next lecture.